extraction facts. And I'm here with Dr. Yoo from the Tooth Doctor.
Hi there.
And he's going to break it all down for us today. So we're going to start off with a quote. The best and cheapest dentistry is when the right thing is done extremely well the first time and it lasts for a long time.
For sure, I agree with that.
It's an unknown quote, but it seems like common sense, right?
Mm-hmm.
Yeah. And Health Canada says that 73% of Canadians brush twice a day. That's actually higher than I would have expected.
That's not bad.
Yeah, it's not bad.
Some of the patients that I've seen.
So do you have any interesting stories or quirky things about pulling teeth that you want to share with anyone?
Well, at Tooth Doctor on Ellerslie Road, we sometimes have had some tough situations. But I actually, I remember a good, very, very cool situation. We had this Russian gentleman come into our office. And, I fixed all his teeth and, fixed some cavities and he seemed okay. But I had told him about taking out his wisdom teeth. And he was very nervous. He was like very worried. And this is a big Russian man, I almost want to do a Russian accent, but I don't want to sound rude in any way. Anyways, came in and, his knuckles were white. His palms were sweaty. And I told him, it's going to be okay. We're going to get this done and it's going to be all right. Long story short, I froze him up, got him relaxed, and then, took out 2 wisdom teeth. Finished, done, sat him up. And as I'm sitting up, he's like, "What are you doing?" I was like, "I'm done." He's like, "What? You pulled my teeth out already? Are you sure?" And it was kind of laughable and fun and amusing, but it was just good to know that I made sure that he was nice and numb and he didn't feel anything, and he was actually shocked that we got his teeth out without any discomfort.
That's amazing, actually. That's a great story, too.
Yeah.
Well, that's a good turnout. So, how common is tooth extraction?
The population, our society has gotten much better about health and care for, our well-being. There are a number of people that need extractions. How common is it? I would say it's common enough where I could probably say we do, some extractions at least once a day.
Okay.
Okay.
Yeah. What's the most common reason for tooth extraction?
So getting to that, why is it common? It partially is because people don't see the dentist. Okay. At the Tooth Doctor, we see a lot of new patients coming in. People that see our sign and they're like, "Hey, I should come and visit," but they haven't been to the dentist for like 5 or 6 years, 10 years, who knows? And so a lot of times people wait, and the most common thing I hear is, "I didn't think that I need to come see the dentist because nothing hurts." Well, you know what? A cavity's not always supposed to hurt. Not that it's going to ache or it's going to be sensitive when you have something sweet. Cavities can just kind of creep up on you and get to a point. Once they're big enough and they start hurting, usually it means it possibly is an infection, right?
Oh, okay.
So when people come to see us, they kind of wait a little bit too long, and that's when we're not just doing a quick filling. It's like, "Oh, I can't afford a root canal," or "This tooth basically just," they say, "it exploded and it fell apart," and then that's when we have to take the tooth out.
Wow. What is an impacted tooth?
So at the Tooth Doctor, we see a lot of patients for different extractions, and an impacted tooth is when it's still, you can't see the tooth. It's still in the gums and it's still in the bone. Okay. Now, I met a gentleman who was 84 years old, actually had dentures, had all his teeth taken out, and we just happened to decide, hey, let's take that big X-ray called the pan to see his teeth, and found that he had 4 wisdom teeth, all 4 of his wisdom teeth still in the bone, and they just didn't grow out. So that's what basically impaction is. It's stuck in the bone and it hasn't come out. Sometimes you hear stories of kids, they have a baby tooth that's left because the canine tooth had not come down. It actually kind of grew across, and that's a situation where it just won't come out from there.
Okay. Okay, I have a good question here. Can you actually pull a tooth without sedation?
Well, getting back to my story, the Russian gentleman,
Yeah.
we basically just got him calm, gave him good freezing, made sure he was numb all over, and once I took his teeth out, he was, happily surprised that I actually took him out. He actually thought I was just kind of, he felt a little pushy, and that's it. So a lot of patients we do without sedation. We try and make it simple, but when we have patients that are a little bit nervous, or maybe it's a little bit trickier, we've had patients where we do sedation, oral sedation, and they feel relaxed. It's actually very amusing because I had this gentleman, I took out 16 teeth on a Monday,
Oh, wow.
put in his denture, everything was good. I called him on Wednesday, said, "Hey, how are you doing, boss?" And he's like, "Good." I was like, "Oh, why are you calling?" I was like, "Oh, sometimes for patients, especially when we do a number of extractions, I want to call and just make sure everything's okay, things that you're doing well, and obviously, hopefully, you're taking care of yourself so that we don't get any infections, stuff like that." But I asked him, "Hey, by the way, do you remember anything that happened on Monday?" He goes, "Not a clue." Right? He had no memory of what happened, and that's the great thing about sedation, is that people just feel more relaxed.
Yeah. Oh, that's
Comfortable.
great. Oh,
Yeah.
that's good. Well, you've kind of already answered the next question, I think. You given a hint. Can you pull multiple teeth in one visit?
Mm-hmm. Yeah, we can. We can pull out anywhere from 1 to 10, 20, just depending on the situation. Obviously we want to make sure that patient are cared for. Sometimes we'll do it in stages, so we'll maybe take out teeth, certain the back teeth in one appointment, let things heal, and then pull out the rest of the teeth on a second appointment. And what that does, allows the bone and everything to heal, so that if the patient just has to get a denture or something like that, then it's a lot more comfortable, and the bone is healed, so the denture fits a lot better.
Okay.
Okay.
That makes sense. And how long does it take to heal after there's been an extraction?
Well, from the biological level, for the bone and the tissue, they say it takes a full 6 months for it to completely heal, for the bone to heal, and if there's some shrinkage, that everything is kind of settled and stabilized after a full 6 months.
Okay.
But usually when you take a tooth out, anywhere from a week to 2 weeks is usually a time when everything is healed over, the gum tissues have healed, and the risk of getting infections is very low after like 5 days, I would say.
Oh, okay.
Yeah.
So what advice do you give patients while they're healing?
We have a form that discusses about what to eat, what to do, what not to do, meds if there's any emergencies. I always have on my post-operative forms my cell phone. So you have any emergency, something's going on, call my cell phone, call me. If I need to come to the office, I will be there. I want to make sure that you're healing properly. I don't want any surprises or any emergencies. And so I do give my cell phone out so that patients are well cared for, and I can answer any questions they may have. I had a patient one time, they called me, and they're like 2-3 hours later, they're like, "Yeah, I'm still bleeding. I don't know why. I can't get the bleeding to stop." So they called me. I said, "Okay, well, first of all, I know you're still numb. Number one, make sure that the gauze is actually on the gum tissue, because I know sometimes when they're numb, people kind of feel like they're biting on something, but they're actually biting it between their teeth. They're not actually putting pressure on the extraction site to let it heal or get the bleeding to stop."
Okay.
And then they called me half an hour later, like, "Oh, the bleeding stopped." I was like, "Okay, good," And so even just a little advice,
Yeah.
as silly as it may sound, sometimes it's very, it's needed, and we don't always know, and so giving that advice will be helpful.
And it's calming, I guess, for the patient as well, right?
Mm-hmm.
It's nice when it's an easy fix.
Yeah.
How long do you have to wait to place an implant?
If we have to extract a tooth, ideally we want to wait about 3 months. So 3 months is the time where the bone heals to a degree and the gum tissue heals to a degree where we can place an implant and it'll be solid. So I usually tell patients anywhere from 3 to 6 months is the ideal. As I mentioned before, here at the Tooth Doctor, we want, if a tooth is extracted, it will take about 6 months to completely heal for the bone to stabilize. So ideally 3 to 6 months. Now, what's the issue of waiting longer than that is that the bone can start to actually shrink more. Okay, so we've seen people, they come in like, oh, I'm thinking of getting an implant on this tooth, but I had this tooth pulled out like 7 years ago or 10 years ago. Well, what happens is that bone has shrunk sometimes too much, and now there's the proper size of implant is not possible, and then we have to discuss about either doing bone grafting or gum grafting, or placing a smaller implant that may compromise the overall shape of the tooth. So yeah.
Wow. So why would you recommend that patients replace those missing teeth?
Well, as a dentist, I always think about overall health. Okay, we have 2 hands for a reason. We have 2 feet for a reason. Okay, there are people that don't. They lost a leg, whether it be due to some illness or war or whatever. Can they function fine? They can, but they need help. Okay, there are people that they're blind. Can they live well? Yes, but we're designed a certain way, and even with your teeth are designed for balance. So when you lose a tooth, what happens is, let's say I lost a tooth down here. What happens is the tooth above has nothing biting on it, so your teeth want to be actually touching. So when you lose that bottom tooth, the tooth above actually feels like it should be touching something. That tooth's down there, so I'm going to start growing out a little bit and try and touch the tooth. What happens is the tooth actually starts growing down. The teeth front and back, when you lose a tooth in the middle, the teeth actually start drifting and tilting, okay? And they change shape, and that'll affect your bite. You can end up getting heavy bites, and that can cause some tooth pain. You can get, when teeth are tilted, it's hard to clean. There's more risk of cavities. So, as a dentist, our tooth doctor clinics, we would like to help our patients have an overall balance, whether it be trying to replace teeth with a denture or with a bridge or with implant. That's kind of the ultimate goal. But I understand, there are people that have, financial concerns, or they just don't want to get it done. And I'll be honest, I actually had a situation, and unfortunate as it is, I actually lost a tooth back up here, and I haven't had it replaced. Do I need to? Not really. In this situation, it's a very back tooth, so I know that there's not going to be any shifting occurring. But when you have other places that are kind of within the teeth, there's higher risk of teeth movement, which can open up spaces, cause more food get stuck, cause cavities, things like that. So, but in general, we want our patients to have, if we can fill out all the spaces, it's just better overall spreading of the forces of your bite. There's less pressure on certain teeth, which prevents cracks, chips, just heavy wearing over time, other issues that can accumulate over the years.
Wow, that was great. Lots of information.
Lot of info, I know. So yes.
Thank you so much for answering all those great questions. Thank you for joining us here at the Tooth Doctor YouTube channel. We're glad that you joined us. Don't forget to subscribe to the channel and like the video, and send us a comment on what you learned, maybe something else you want to learn about, and let us know. And we'll see you guys later. Bye.